The next set of speakers that I'd like to introduce are Dr. Brian Morrison and Dr. Jonathan Ho, who are both here in the audience and sitting next to each other right now. Dr. Morrison, Brian is the residency program director at University of Miami, is a jack of all trades. He is a Mohs surgeon and loves the nail unit, but is also really passionate about education and mentorship, both within his residency program and sort of across the global world. And so we're really delighted that he's here. He's one of our GLODERM mentors of this year as well. And then Dr. Jonathan Ho is the director or co-director of the dermatology residency program and the director of dermatopathology at the University of West Indies in Jamaica. He is passionate about a lot of things in patient consultations, complex medical dermatology, education, and training programs. And he has done a lot in clinical pathologic collaboration. He is one of the co-directors or deputy editor-in-chief for Pathology Outlines. And really excitingly, he is the awardee, one of the awardees of the 2025 ILDS Young Dermatologist International Achievement Awards recipient for Latin America. So we're so delighted to have this dynamic duo come up and speak here today. So thank you.
Good morning. Is everyone hearing me? Yes, okay. So I'm Jonathan. It's such a pleasure to be here. Thank you for the invitation. Those are disclosures, non-relevant. And this is just to start us off with a little bit of geography. And I always think people know where Jamaica is. And I think people know Bob Marley and Usain Bolt. But when I was here, people would ask me where in Africa Jamaica was, or if Jamaica was a state in Haiti. So just to remind us, Jamaica is there in the Caribbean Sea, just beside the Gulf of Mexico. And you can see here that we are the only English-speaking island in the Greater Antilles. But then you have that whole set of smaller English-speaking islands in the Eastern Caribbean. Now, before 2019, so we are truly an emerging residency program, we're young. And before 2019, the paths that most dermatologists took to training were either through the UK or through the United States, and they were in international training programs. But there were nuances and there were different advantages and disadvantages to them. So the UK program typically was a one-year master's or diploma, either at King's College or Cardiff University. And the problem with this program was that it was kind of like observership status. So you would go for a year, but when you came back, you still needed to work for an additional 3 years under some sort of supervision before you could register as a specialist. It was somewhat costly for people, around £20,000, and with living expenses, maybe up to $40,000 for the year. But because the 1 year of official training was an observership, even though you could register as a specialist, it was very difficult to get like an attending or consultant post at one of the hospitals. And so if you wanted that post, you really need an additional residency training, so either in internal medicine or sometimes family medicine or pediatrics. The US training program for internationals was really just one at Boston University. And so for registration as an attending, you needed 3 to 4 years of continuous training. It was hands-on, but quite costly. And so most persons had to be government sponsored or hospital sponsored to afford it. The tuition was around $240,000 for the 4 years. And Boston is, one of the most expensive cities in the US and the world. So roughly $400,000 for that 4 years of training. Unfortunately, that program is no longer open. The advantage was that you were immediately registered as a specialist and you could hold a hospital consultant post. So I think one of the things that we realized, certainly around 2019, is, you can go wherever you want. Everyone should have the opportunity to train where they want to. But if you wanted to train in the Caribbean, you should also have that opportunity. And I think that was one of the major reasons that we, embarked on starting this residency program. And so in Jamaica and the English-speaking Caribbean residency programs, graduate you with a doctorate degree, and a doctor of medicine in dermatology is the name of the program. So it's a 4-year training program. It's 3 years of dermatology and then a year of internal medicine. And that's separate from the year of internal medicine internship that these residents do. So it's kind of heavily med-derm focused. And that's, good, but also, we do have some shortcomings in terms of like cosmetics and surgical, and we will talk about that in a little bit. The year of internal medicine, though, is split up into 3-month blocks because nobody wants to have done internship and then come back to residency to do another year of internal medicine. And we split them 3 months in general medicine, endocrinology, rheumatology, and infectious diseases over the 4-year period. We do have an original research requirement for graduation, so you actually can't sit the exit exams until you have finished your research. And of course, it's the faculty setting these exit exams which license you to practice not only in Jamaica but in all of the English-speaking Caribbean as well as in Bermuda. And so we do need external examiners to come in. And so we've been pretty fortunate over the last couple of years to have Lynn Goldberg as our external examiner. And so you can sit up to 5 years as the external, and then we have to get a new one. They review the papers, they come to Jamaica for the oral exam, and it really is quite a useful and fun partnership. So our residents do get a relatively broad exposure to MedDerm, and we're really proud of our inpatient dermatology service because we're the only hospital that offers a full inpatient derm service in the English-speaking Caribbean. So otherwise you admit, much like in the US, except for University of Miami, to internal medicine and then the dermatologist sort of monitor. But we have our inpatient ward, and so we do admit a fair number of blistering diseases, TN, SJS, etc. Complex MedDerm is something that we also, expose our residents to quite a bit. But, the caveat is that because we're a tertiary institution and you need a referral to get into our system, sometimes they don't have enough sebderm or acne to see in the clinics, which is still an important part of what we need to train our residents to be competent in managing. We do some photomedicine. One of our faculty members is fellowship trained in cutaneous oncology, so they get a fair amount of lymphoma and, of course, acrolentiginous melanoma. Dermpath is there. And up until very recently, we had an HIV-associated dermatosis clinic. However, with the USAID changes, that's currently on pause. These latter three, we have exposure, but I think somewhat limited. Procedural dermatology, so they're certainly doing their biopsies, taking out cysts, but any sort of advanced dermatologic surgery exposure, I think, is relatively limited at this time. And I think, Brian will talk a little bit about that. And pediatric derm, the pediatricians have just got accustomed to not having dermatologists, and they kind of just manage a lot of their dermatoses. So we're trying to build that relationship and hopefully get one of our residents into a pediatric dermatology fellowship in the coming years. And then our cosmetic derm is almost zero, few chemical peels, and we may get a hair removal laser soon, but we have very little. So these are faculty members. So we have 5 faculty members, and again, pretty broad in terms of medical dermatology, but procedurally, only one of our faculty members is really super procedural, and he is, just about retired. And I think that's one of the things that we are realizing in the next few years. At least 2 of our faculty members are not going to be on faculty, and so 3 faculty members is kind of small as we're hoping to grow this residency program, and to point out that we're training not just for Jamaica, but really for the English-speaking Caribbean. We're the only training program in the English-speaking Caribbean. So in existence in terms of clinical services, Genderm clinics, wound clinic, complex MedDerm clinic, we have a phototherapy unit, Narrowband in particular, and our HIV clinic is still theoretically operational. It's just on pause until we kind of figure out what's happening with the funding. And then coming soon, we will have a room derm clinic because one of our recent graduates is at Boston University doing a 1-year fellowship in rheumatologic dermatology. So she's slated to get back in September. So we're pretty excited about that. And hopefully we'll have PD derm, hair clinic, nail clinic, and Mohs surgery in the future. And we do need, we actually did a recent review of our non-melanoma skin cancers, and 65% of them would meet the Mohs appropriate use criteria. So it's not that there is no need for it. We don't need 10, but we could do one with one Mohs surgeon in Jamaica. Our residents are active in research, and so these are all papers that they've been a part of publishing. And again, we try and insist that once they've finished their thesis requirements, that should sort of eventuate into a publication. And so the research this year is focused on hidradenitis suppurativa, cutaneous T-cell lymphoma, autoimmune blistering diseases, and photomedicine. So we're excited about their interest in research. This is our current resident body. And we do train for the region. So Jamaica, obviously, many of the residents, we currently have 12, but we have persons from Barbados, from Trinidad and from St. Lucia. And in this year's intake, we had applicants from the Cayman Islands, from Bahamas, from St. Vincent and the Grenadines, and St. Kitts and Nevis. So we will certainly be expanding out of Jamaica. And it's our mandate to take, 2 Jamaicans per year and at least 1 person from the Eastern Caribbean. Our recent graduates, we've had 2. We had a gap year because of COVID, and we're proud of what they're doing. And Alicia is actually the person who is at BU doing room derm, so we're looking forward to having her back. Now, in terms of our challenges, I think one of the major challenges that we had initially was we want our residents to have international exposure. We are aware that we're a small and emerging program, and so we want them to get the expertise and the broad exposure that we cannot give in Jamaica. So international elective time was initially quite an issue. But thanks to University of Miami through Brian, we've been able to, solve one of, that first challenge. Clinical exposure, I think the surgical dermatology, pediatric derm, and cosmetic derm, as much as we are heavily med derm focused, we do want them to have as broad a residency experience as possible. We want subspecialists. And so international fellowships are, as many of the emerging residency programs will tell you, very hard to come by. Licensure and just sort of availability is an issue for international subspecialty training programs. And then I think a major issue is we had no problem getting the residency program approved, but these residents are graduating wanting to stay in either public service or academics, and there are no jobs for them. And so we want to take on faculty to expand faculty, but that's hard because that costs money. Now, in terms of the faculty or sort of systemic issues, I think we have a relatively small faculty. It's 5 of us, and that will soon be down to 3. We are the mentors for the other dermatologists in the country, and so there's relatively little faculty mentorship. And then 5 persons. Sometimes the problems that you need to solve are beyond the capability of the 5 persons in the group, and so that can be somewhat challenging. And I think there is a potential for faculty exhaustion, the same 2 or 3 persons supervising all the residents year in, year out, theses, et cetera. I think that is a real risk. And, we have some issues with lack of equipment or maintaining the equipment. One of the things that we have come to realize is that meaningful collaboration is essential for small and emerging residency programs to overcoming the various challenges that I've been sharing. And so we have some international partners, Miami, Boston University, and King's College, but I think one of those looms particularly large. And I think the ideal partnership, as we are learning, is a sort of elder siblingship, rather than a sort of paternalistic relationship. Well, elder sibling with means, though, right? So you don't want them living in the same house. You need somebody who can really advise and can help you to solve the challenges. And I think we have found that partner with University of Miami. And I don't want to gush, but Brian Morrison has really just been amazing at sort of facilitating our residents coming, and he'll tell you a little bit more about that. I feel like I am gushing now, and I think I'll hand over. But we know we're fortunate to have this nearby partner. So thank you very much for listening.
Well, thank you so much, John. And it's crazy. We've only been working together for 14 months. Yeah. It feels like it's been a lot longer. I feel like I've known John for ages. And so it's really been absolutely wonderful having this partnership with the University of West Indies and John and his faculty, who are phenomenal, and his residents are absolutely phenomenal as well. And we're lucky in Miami. We're actually very well positioned to help support John and his department and his residents for a couple of reasons. So the first reason is just where we are in Miami, right? So it's easy for people in Jamaica to visit Miami. It's a direct flight, right? That's true for most of the Caribbean and Latin America. There are direct flights to Miami. So it's not such a challenge. And a lot of people come to Miami already to visit family. It's not a foreign location. It's pretty accessible for people in this region. The other thing is that Miami is very unique as cities go. 65% of our population was born outside of the US. So it's a city of recent immigrants. This is much more than any other city in the United States by a lot. And so there's a bit of a trickle effect in that many of our residents, medical students, faculty, they were also trained abroad, right? And this has created an environment that's very welcoming to international learners. And as you saw, Dr. Jose Oyagi is a graduate from our program. We were co-residents together. And so we have graduated many dermatologists who did their medical, education abroad. So for the right people, we're very open to that. And then the last thing is we have a very large program. So we have tons of clinical faculty. And so bringing in outside learners doesn't have a negative impact on our ACGME learners, which is really important, right? You don't want to dilute the experience of the people who, we're primarily responsible for training, but because our faculty is so large, we can accommodate a lot of people. And so for these reasons, we're very well positioned to help him. So is it going to go forward? Oh, I went too far. Let me go back. And so, the basic approach to stage is nothing revelational, right? So we're focusing on education. I'll briefly mention that mentorship, which I think is the most important thing, because this is where you really have, a connection, a personal connection with someone. You create a relationship with them that goes forward and hopefully on to the rest of your life. And so here in the picture under mentorship, it's me, my husband, and then two of Dr. Ho's residents, Rodane and Orchid, both of who have spent a significant time in Miami. And then my resident, Karishma, so she's graduating this year, who joined me to Jamaica. She hosted Orchid when she was visiting Miami for 3 months. They were roommates together. And so we're really fostering long-term relationships that hopefully will be very meaningful and will go forward for years to come. So this is critical. And then, of course, sponsorship is very, very important, right? We want to try to identify opportunities to really engage John's residents in particular and his junior faculty to try to get them more involved and to help advance their careers. So, one way, of course, of doing that is through scholarly activities. So we've tried to engage his faculty and residents with my faculty, right, to also foster relationships, broader relationships. Education, of course, as we mentioned. So his senior residents have been coming for 1 to 3 month rotations in Miami. So they're currently observerships. So they're not allowed to provide direct patient care, but they're allowed to be in the room, help, they're allowed to talk to the patients and get a history, come out and present. But they're not allowed to do any documentation. They're not allowed to do procedures at this stage in the game, but they get to see how medicine is practiced by our very large and diverse faculty. So it's beneficial. We've helped them get resident rates for all of the conferences that we're associated with in South Florida. And also it's easy for them to visit because, again, just a direct flight. And then I've also come to Jamaica a couple times to teach, and hopefully more of our faculty will also go. Hopefully John will invite more of our faculty to come and lecture there as well. And then, the sponsorship side, again, identifying and creating opportunities is so important for advancing career and professional development. And so 2 things that we've really focused on. So the first one is we've managed to get some grants, which is nice. So the first one is the AAD Skincare for Developing Countries grant. So John and one of his residents, Orchid, were the recipient of this grant to help develop a surgical curriculum, right? Where, he's and Orchid are very much investing in her career to try to make her the future derm surgeon for the island, right? And the Mohs surgeon for the island, someone who can take the place of Dr. Fitzhenley, who will be leaving shortly. So this is a way to help bring US surgeons to Jamaica and teach them there in Jamaica on their own patients. And so we're very excited about this getting started. The second, I just found out 2 days ago, we got a grant for, melanoma awareness in Jamaica. So we'll have some public health engagement as well in Jamaica. So that's great. Our institution provided this grant to help move this forward. So fantastic. And then the last thing is the thing I'm most excited about, which is the Global Health Clinical Fellowship. So this is a very special fellowship. It's called an NST, a non-standard training fellowship. And so what this allows for is that a foreign physician, in this case, it would be a foreign dermatologist, would be allowed to come for 1 year on a J-1 visa to the US, and they would be allowed to directly participate in patient care, right? So they can do surgeries, they can write notes. They would basically be functioning at the level of a resident. All right, they would need to be supervised, of course, but at the level of, a junior resident. And it would allow for a lot of, flexibility. We could cultivate the curriculum to their needs, right? If they want to be a pediatric dermatologist, they spend more time doing pediatrics. If they want to do surgery, we put them in surgical clinics. If they want to do dermatopathology, we have them spend more time with their dermatopathologist and really try to cultivate the experience based on their specific goals and needs of their community. The other thing that's really special about this is that it's a paid position. So the person who comes would have to receive a salary of a PGY2 resident. They would get full benefits, healthcare, malpractice, you name it. It's all there. They're treated identical to a PGY2 resident for that 1 year. So, you know, the challenge, of course, is identifying funding sources. We have a few in mind, and my department has generously even offered to fund the position if there's really an exceptional person and really meets the goals of the project or program, which is to generate future leaders in dermatology, international leaders, people who will go home and be leaders in the communities, will be academic physicians who will really advance dermatology. So this will probably start not this July, but next July. So, and that's it. Thank you.